I want to thank the residents of Wisconsin. We know you are working so hard to follow the safer at home physical distancing guidelines to flatten the curve. Research coming out of the World Health Organization on COVID-19, as well as research on previous pandemics, all support strategies like safer at home and our physical distancing policies. The point of these policies is to buy more time in order to build our healthcare capacity, buy needed medical supplies, find more healthcare professionals, ensure adequate hospital bed and critical care capacity, increase our testing, and bulk up our contact tracing teams to get our state ready for the surge and beyond. The health and well-being of the residents of Wisconsin is our focus, and that is why we are taking further action today. The upcoming election is a statewide election, and it requires a statewide solution. In-person voting, by definition, inhibits our ability to physically distance, and the recent consolidation of polling locations in many parts of Wisconsin would result in mass gatherings. In-person voting would, without question, accelerate the transmission of COVID-19 and increase the number of cases. And an increase in the number of cases in Wisconsin would result in more deaths. Throughout this response, we have put the health and safety of Wisconsin residents first, and that is why I and the DHS public health experts advised Governor Evers to avoid the mass gatherings that would result from an in-person election on Tuesday. In addition, I have signed 2 emergency orders today regarding our healthcare system. The orders allow healthcare facilities, providers, and emergency medical services flexibility to address staffing needs so they are able to provide needed care. The order adjusts training and license renewal deadlines, as well as paramedic level ambulance staffing levels for emergency medical services. It suspends staff orientations at home health agencies and hospices, adjusts nurse aid training hours, relaxes criteria for resident care staff at community-based residential facilities and adult family homes, and ensures nursing homes cannot discharge patients who are unable to pay. The order also modifies requirements at opioid addiction treatment services so staff can continue to be responsive and accessible. Finally, they allow healthcare provider licenses that would have expired during the public health emergency to remain valid until 30 days after the emergency is over. In order to assist with this patient care, we'd like to give you an update on PPE, or personal protective equipment, that has come to us from the Federal Strategic National Stockpile. The total PPE Wisconsin has distributed from the Strategic National Stockpile includes 104,680 N95 respirators, 260,840 surgical masks, 48,168 face shields, and 140,750 pairs of gloves. This PPE will help protect our medical professionals as they do their important work of treating COVID-19 patients who need care. However, what we have received from the Strategic National Stockpile barely begins to meet the need or the requests of the Wisconsin healthcare system. In addition to the SNS, we continue to process PPE made available by the buyback and donation program that the governor launched last month. We have distributed supplies from these sources, including 15,100 N95 respirators, 24,200 surgical masks, and these have gone to public safety staff, including police and fire departments, to protect them as they do their essential work during this pandemic. We know this is a time of unprecedented stress for so many, and especially for our frontline healthcare workers. That is why our new website, resilient.wisconsin.gov, offers tools and resources to reduce stress during this pandemic. There are pages dedicated to helping first responders and healthcare workers, and there are also pages for the rest of us to learn more about mental health well-being and self-care, tools to reduce stress and to stay connected in this time of physical distancing. These tools are so important because we know that safer at home is what we need to do to flatten the curve, and reducing our stress so it's possible to follow these guidelines is essential. I want to give an update now on our numbers for today. Here's where things stand. We've got 12 active labs running COVID tests in Wisconsin with a daily lab capacity of 3,563 tests. We have 26,574 negative tests, which is an increase of 1,405 over yesterday. We have 2 counties reporting cases for the first time, Kewaunee and Waushara, and there are now 2,440 positive tests, an increase of 173 positive COVID people here in the state of Wisconsin. Our number of COVID hospitalizations is 668, which is an increase of 44 over yesterday. And this means that 27% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total deaths to date have now reached 77. The new deaths today include 1 death in Dane County, a male in his 90s, 6 additional deaths in Milwaukee County, a male in his 50s, 2 males in their 70s, and 1 female and 1 male in their 80s, as well as 1 male in his 90s. In Racine County, we have 1 male in his 70s that has passed away, as well as 1 male in his 60s in Winnebago County. Again, we honor the memories of those who have passed and grieve their loss and grieve for those who are also experiencing this loss. When the numbers increase, it is easy to think of this pandemic in terms of graphs and the numbers on our web pages. But we need to remember that each number represents a person, a friend or family member, a neighbor or a coworker. When we each do our part to flatten the curve through physical distancing and staying safer at home, we are doing our part to keep ourselves and others healthy and safe. And we are doing our part to give us time that we need to make sure our healthcare system and our frontline healthcare workers have the capacity and the tools they need to meet this challenge. Thank you for continuing to join us in that work.